Welcome everyone to the latest installment of CADCA's Research into Action webinar series. My name is Katrina McCarthy and I am a member of CADCA's Evaluation and Research team. If you haven't previously participated in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition field. Today's webinar is in collaboration with CADCA's Geographic Health Equity Alliance, or GEA, which is a CDC-funded national network dedicated to reducing health disparities related to tobacco and cancer. GEA's focus is on reducing geographic health disparities, which they define as the differences in health behaviors, outcomes, and policies related to where people live, work, and play. For more information about GEA and promoting health equity, you can visit geohealthequity.org. And so I'm joined for this installment by Dr. Jordan Alpert. He will present on his and his colleagues' article, Vaping and Instagram, a content analysis of e-cigarette posts using the Content Appealing to Youth Index, which was published in Substance Use and Misuse in 2021. He'll discuss how coalitions can address media literacy to educate young adults about ENDS content viewed on social media. And on to the next slide, please. So I just want to go ahead and introduce our presenter, Dr. Jordan Alpert. He is an assistant professor in the Department of Advertising within the College of Journalism and Communications at the University of Florida. He also leads the U.S. Health Cancer Center's eHealth and Cancer Informatics Working Group. Dr. Alpert's research focuses on the influence of technology in healthcare, particularly patient-provider communication, online information seeking, and discussions that take place about health in the social media environment. Prior to joining US, Dr. Alpert was a postdoctoral fellow in cancer prevention and control in the Department of Health Behavior and Policy at Virginia Commonwealth University's School of Medicine and Massey Cancer Center. And so now I will go ahead and turn it over to Dr. Alpert to discuss his work.
All right, thank you very much. It's a pleasure to be here today. Thank you to CADCA and GEA. Today I'll be summarizing a study that Katrina just mentioned. This study focuses on identifying the most popular characteristics of e-cigarette content appearing on the social media platform Instagram. So I'll begin with a short overview of electronic cigarettes and their related products. Most of you might be familiar with a lot of this information already. Things tend to change pretty quickly in this space. So forgive me if you know about this already, but hopefully it's a little bit of a refresher to everybody else. Throughout the presentation, I'll use the phrase ENDS. ENDS stands for Electronic Nicotine Delivery Systems. This phrase really encompasses all the different types of products of e-cigarettes that are out there, starting with the image on the left over here. This is one of the first iterations of an ENDS product. It looks like a traditional combustible cigarette. Other devices use a battery, they heat up liquid, and they usually contain flavors and nicotine. And as you can see, the design of ENDS products has evolved to all sorts of shapes and sizes. Larger devices have been developed known as mods. These are a few examples of mods. Mods is an abbreviation for the word modify. And that's because these devices are very customizable. They allow users to customize them and modify them in ways so that they could create a lot of smoke, really big smoke clouds. And that's really appealing for most people. As you can see, they're also very colorful. They're unique. And this enables them to be marketed in all sorts of different ways and definitely attracts more attention. Now, there's good news about general smoking behavior, and that's that traditional cigarette use is declining. But there's also some bad news, and the bad news is that ENDS use is increasing. This is particularly true for young adults and even teenagers in high school. This chart that you see right here shows that 27.5% of high schoolers have tried e-cigarettes, ENDS products, compared with only 5.8% who have tried traditional cigarettes. And there's been a 78% increase in ENDS use among high schoolers. The 18 to 24 age group has the highest prevalence of ENDS usage. And this is so concerning that the former Surgeon General of the United States declared that the rise of youth e-cigarette smoking is an epidemic, saying that there's cause for great concern and urged action to be taken. One of the reasons why ENDS has become so popular, especially among young adults, is because of the wide assortment of flavors available. You have your typical flavors like your strawberries, your cherries. There's also the more exotic flavors like cheesecake, bubblegum, candy flavors. Now, there was a bill passed last year that banned flavors, but as of now, it's only applied to cartridges. So like the Juul device, if you're familiar with that, cartridges where you could input the flavoring. There's a lot of debate about whether flavors will still be available in the future, but as of right now, young adults have found ways around this, and they could still access and get flavors pretty readily. Now, it's important to note the science of e-cigarettes and ENDS products. It's not entirely known. Now, what I have over here, this is just a small sample of studies indicating that ENDS is harmful, especially harmful for young adults. Recent studies show that they affect the lungs, the brain, and they can even make people more susceptible to getting COVID-19. There's also concern that e-cigarettes and ENDS can serve as a gateway to further tobacco use, and people could then turn to traditional cigarettes and other forms of tobacco. Now, to be fair, there are benefits towards ENDS as well. One of the benefits is that it assists with smoking cessation of traditional cigarettes. Now, this is great, but it doesn't apply to young adults because most young adults have never smoked traditional cigarettes. So using ENDS as a smoking cessation device doesn't really work. It doesn't make much sense. Despite these studies, most young adults, they're not very well educated or aware of ENDS products. 66% think that the only thing in their device is flavoring and not nicotine. So the question is where are young adults learning about ENDS and where are they being exposed to ENDS products? One place that seems kind of logical is advertising. So I have a question for you, if we could put up the poll question. This question asks, where are ENDS advertisers spending the most money to promote their products? Is it television, print, like magazines or newspapers, radio, the internet, outdoors? So I'll give you a minute to answer that, and then we'll look at the results. All right, looks like voting might be done. Okay, here we have the results. So overwhelmingly the internet. So that's a logical answer. That makes sense, right? This study that I'm talking about is about the internet, right? So it would make sense to think that the internet is where most advertising for ENDS products is occurring. So we have 91% who said the internet, TV at 2%, print 3%, radio 1%, outdoor 3%. All right, well, let's look at the numbers and see. Okay, so actually, if you look, print is where the most money is spent on ENDS advertising. The green line here indicates the total number of spending. So in 2018, over $100 million in spending, print up there around $40 million. But you might have noticed that online internet advertising is pretty much right on the bottom. It's pretty much non-existent. So why is that? Why is there so little advertising money being spent online? Well, the answer, I think, is that ENDS products don't need to advertise online because they have the consumers advertising for them. They get consumers to promote their brands and the overall act of vaping on their behalf. And if you've ever met anyone between the ages of 18 to 24, or even younger, you know that they get all their information and pretty much live their lives on their phones, especially using social media. So this chart right here, this shows that among 18 to 29-year-olds, about 80% use at least one social media site. They spend about 2.5 hours per day on social media, and 73% visit Instagram at least once per day. Instagram's the second most popular social media site among 15 to 25-year-olds, with 63% on Instagram, which is only behind YouTube. It's easy to be exposed to all types of content on the internet, especially ENDS content. Young adults come across this content fairly regularly, so it's safe to assume that online media is a primary source of their exposure and education of ENDS products. So knowing this, the purpose of the study that I'm going to talk about today was to identify the types of ENDS content that is most popular on one of the most popular social media platforms, Instagram. I wanted to know if the attributes of ENDS posts cause them to be popular. Because if we don't know what young adults are viewing online and why it's popular, then it's really hard to do anything about it. So based on a previous study, I found that two of the most popular hashtags where vaping content, ENDS content is usually associated is vape and vape life. A hashtag is a keyword that identifies digital content on a specific topic that's usually included in a social media post. So what we did is we searched for these keywords, these hashtags, vape and vape life, and we began collecting the top posts from each of these hashtags beginning in August 2019, all the way through through December. So just historically, there's a lot of posts related to these hashtags. So vape has 29 million posts. Vape life had about 17 million posts. In order for us to include the image, we had a certain threshold. The image had to have at least 1,000 likes. So if people see an image, they could click that they like it. We had at least 1,000 to be included in the study. Now, it's typical for an average ENDS post from just your typical post related to it to get about 150 likes. So these likes, these images that we collected weren't just your typical run-of-the-mill Instagram posts. These were truly the outliers, the posts that people were liking that really generated a lot of attention. Now, before I get into what we did, it's important to acknowledge what we didn't do. We didn't analyze who was posting the image. The post could have been made by an influencer, maybe an ENDS brand, a vaping shop, or even just your everyday individual. We also didn't analyze comments. So often alongside the post, the image, there's a discussion that goes along where people can comment and sometimes a conversation occurs. And we also didn't analyze videos. On Instagram, it's enabled where you could upload videos as well. So in total, we collected over 1,000 images. And when we excluded the videos, we wound up with 741 total images. The way that we went about categorizing each post was to use a system called the content appealing to youth. This is also known as the K-index. The K-index was originally developed to analyze alcohol advertisements that were specifically targeted to youth. And it was updated in another study for e-cigarette ads. So in this study, we took the K-index and we made some modifications just to make sure that it was suited for social media, specifically social media. There are 6 general topics in the K-index, and it represents 35 specific features and attributes. The first one is production value. Production value is the kind of the stylistic feature of the post. So is the post a photo? Is it an illustration? Is there action, some sort of movement? Is it in color? So that's an example of some of the attributes. Characteristics, they're the specifics of what is in each post. So for instance, are there people in it, humans? If there are they adults? Are they youth? Are they younger people? Is faces visible? Can you detect the gender? Youth-oriented themes, these consist of things like a fictional spokesperson, the use of humor, sometimes violence, and things like that. Product appeals were aspects of the image specific to the product or device. So this would mean things like looking at the actual device that is featured, and is it shiny or is it dull? What is the texture like? Is there a presence of smoke coming from the device? Rewarding appeals were considered positive outcomes from using the product. So these are things like depicting success or maybe romance, sexual connotations implied in the image. Then we have risk content. So risk content was when unsafe depictions were shown. These are things like injuries, maybe warnings about the health risks of using ENDS products, and how it might affect physical performance negatively. So me and my research team, we collected all these images, and then we reviewed every image individually, and we checked and went through all 35 different categories to note whether the specific attribute was present or not present. And we had several measures to make sure that we were all categorizing content in a similar manner. All right, so next I'll go through the findings. I'll go through each category one by one. The first category was production value. So remember, these are the stylistic features of the post. We found that most images were photographs and not illustrations like this one seen here. Almost all of the images were in color as opposed to black and white or monochromatic. Only 12% of images featured action shots. So what we mean by this is a picture that captures something that would normally be moving. So a good example is smoke. Normally smoke is moving around. Action would capture that image of the smoke. Next, we looked at characteristics. These were the specifics of what was in each post. Surprisingly, there were not many people in these images, not a lot of human beings. When pictured though, 14% were adults and 4% were categorized as youth. We defined youths as under 25 years old. Now, there was really no way of us knowing for sure what a particular person's age was. So this was a subjective process about how we went and determined that. But overall, we weren't seeing a lot of people in general. Men were more likely to be featured in the post than women when they were pictured. The next category was youth-oriented themes, such as fictional spokespeople and humor. We hardly saw any of these themes. The examples given here, these would probably be categorized on the humorous side, as you see kind of little memes being created, some little illustrations with fictional characters. But this was not rampant at all in the images. So you may have noticed so far from looking at some of the images that I featured that mods are particularly present. In fact, mods were the most featured image in all of the posts. In 84% of images, the vaping device was the centerpiece. 42% of the devices were very colorful. They had contrasting colors, meaning there were different degrees of colors used. It wasn't just kind of one or two. There was a lot of contrasting different colors happening. Smoke was present in 12% of the images, and only 4% showcased flavors. And possibly this was due to the upcoming flavor ban, which was being discussed around this time. There were some images of hookahs, but almost no images contained information about health. And when I say health in this context, I'm talking about health that would talk about how ENDS doesn't affect you negatively. So talking about maybe the positive aspects, maybe smoking cessation or other health benefits of using ENDS, that was very rare to be found in the images. Tactics that we commonly see in advertising and persuasive messaging were not common at all in these Instagram images. Very few images showed positive sensation experiences. These are things like showing people really happy, experiencing the product, sexual connotations, or instances of independence or success. We also didn't see many images around adventure or people celebrating together. Lastly, the last category, 28% included some type of warning, like what you see here. So the warnings were either on the top, taking up a lot of real estate of the image, as you see, or it was a little bit more subtle down here with the 21 age requirement. There were a few posts about injuries resulting from vaping, or how it may, but none about how may it affect physical performance. All right, so what do these results really mean? Well, most Instagram images were simply a picture of the device. That's it, just a picture of the device. And remember, these images are getting thousands and thousands of likes. They're not really very funny. They're not showcasing relatable young adults looking cool. It's really just the device. So if you think about images on Instagram of other kinds of risky behaviors, like alcoholic beverages, for instance, it's common to see celebration, people together having fun, going on adventures, and so on. But we're not really seeing that with ENDS products. Only the device is being displayed. However, I have to admit, the devices are interesting to look at. there is a certain cool factor associated with some of these devices. And this really reminds me of cigarette packaging. The packaging of cigarettes was a powerful method to attract new smokers, especially young adults. The packages of cigarettes, some examples right here, they were designed to stand out on the shelf, to stand out in the vending machine. They were colorful and they were bright. Now, it's important that these images are colorful and bright because young adults scroll through Instagram all day long. They look at hundreds, maybe thousands of images at a time. So just like cigarette packaging, the devices and the images, they have to be really dynamic to get attention and stand out. Almost all of the vaping images showcase the act of vaping in a very positive light. Aside from warning labels, which accounted for about 28% of the images, there was no information about how ENDS negatively affects health. After seeing these results, I was a little unsure that a simple image of a mod would be so popular to generate thousands and thousands of people liking them. Was looking at this type of device really that interesting? So next, I decided to conduct a companion study. Young adults were interviewed, and we showed them images from the study that I just mentioned. And we asked them what was most appealing, which images, and why were they appealing? Now, this study isn't published yet, so I'll just quickly go through some of the preliminary results. We interviewed 24 young adults, mostly female, on average 21 years of age. The majority of participants really didn't vape that much. They only vape socially, or they haven't vaped in over 6 months at the time of the interview. And they were also very heavy social media users, using at least 4 different types of social media platforms. We showed participants a variety of images and asked them to select their favorite. These images here were overwhelmingly the favorites, and both of these showcase the vaping device. Participants used words like cool and inspirational to describe these images, and one participant noted how the colors of the device would make them look at the image a lot longer than they would look at different images. Another interesting takeaway was that participants didn't want to be associated with vaping culture. They were aware that family members, even friends, could see their activity on Instagram, and they didn't want to be thought of as a vapor. They paid attention to images that received a lot of likes, so they noticed when an image received thousands and thousands of likes. And while they liked the images that we were showing to them, they told us that they wouldn't necessarily click on the button to indicate that they did like it because it would be broadcast to their friends and family. So we need to think about all the different types of users and mindsets of young adults. It's not as simple as bucketing them all together, saying we have our vapors and our non-vapors. It really doesn't work like that. We also need to consider the culture of each social media platform. So studies that were conducted just looking at different social media platforms, such as Reddit. Reddit is mainly used to discuss different flavors. We'll see if that's still the case with maybe the lack of flavors coming up. Twitter was used to find different promotions and to emphasize the value of using ENDS compared to traditional cigarettes. Smoke tricks are very common on YouTube, and TikTok is used to showcase the vaping lifestyle. Instagram, however, it's used to capture images and record the lives of users for themselves and close family and friends. It's not necessarily to broadcast their images to the public or larger audiences. So what we're really seeing here is the cycle keeps occurring. We have young adults spending a lot of their time, most of their time on social media. And while they're there, they're being exposed to very positive and interesting images related to ENDS. Now, this has the potential to shape attitudes and lead to trial or even long-term usage of ENDS products. Instagram and other social media sites have put in place some rules to limit promotion of ENDS, but it's very hard to enforce. In order to reduce young adult vaping, we really have to think about the messages that we put on social media. Campaigns should be created that inform young adults rather than trying to scare them, causing them to rebel and even experiment with ENDS. This is known as the Boomerang Effect. Some of the ads you see here, these are kind of classic examples of the Boomerang Effect, where when people see these ads, especially young adults, they tend to look away. They don't want to see images like this. They ignore the message, And it actually makes them a little bit more curious about trying the product, wanting to rebel against what everybody thinks is going to happen to them. They rebel and ends up trying the product anyway. The Truth Initiative, which is a big anti-smoking, anti-vaping campaign, they came out with a really innovative program recently where young adults could text messages and they received messages back helping them and motivating them to quit using ENDS products. Now, I think this is a really good campaign, but we've already seen evidence of the potential for the boomerang effect to take hold. This is the very first comment that was posted under this campaign being posted on YouTube. And this is the definition of the boomerang effect, saying that, yeah, this kind of makes me want to vape again, wants me to get back into it. However, more research should be done about warning labels in social media. In the interview study that I mentioned, participants really noticed these warning labels. And although they didn't necessarily like it because they were more focused on the other content and wanted to look at that, this is a good way of keeping some of the health consequences top of mind when it comes to vaping. Another tactic to consider is the use of influencers. Now, influencers have been used to promote ENDS products, but we could use them for the opposite. We could use influencers to spread information about why not to vape. This is a popular influencer who shows herself vaping pretty regularly. But during the pandemic, there's been this really great example of social media influencers being used to increase vaccination rates among young adults. So there's a lot of trust that's engendered in influencers. So using them and motivating them to spread a message of not using ENDS products, not vaping, and maybe informing them about some of the negative health aspects could be a successful program. Now, this type of messaging, anti-vaping messaging, really needs to be widespread because right now, pro-vaping content greatly outnumbers anti-vaping content, 10,000 to 1. Lastly, health professionals like doctors and nurses, they're considered trusted, very trusted, especially when discussing health information like ENDS. Now, there's opportunities to discuss ENDS during appointments, and there's one study that found that teens and doctors tended to discuss more topics when parents were not in the room. They talked about some of these risky behaviors more openly than when their parent was right next to them, which makes sense. So there's certainly an opportunity for health professionals to really incorporate this and emphasize this when young adults come to their offices for consultations. Health professionals could also use social media instead of waiting for patients to come to the office. This one example here is a doctor who started posting videos on TikTok talking about some of the dangers of vaping and ENDS products. And it's been very popular and successful. So overall, there's a lot of work to be done to educate young adults and to reduce the high levels of vaping that we're seeing. And one place to start out looking is social media, to try to put messages in there, to plant messages and create a different narrative than this very positive environment of pro-vaping. Well, thank you all for your attention. I really appreciate it. The study that I discussed can be found here. My co-authors who contributed to this research are Huan Chen, Heather Riddell, Yujin Chung, and Angela Mu. Thank you very much.
All right. If you could go to the next slide, we will go ahead and get started with our Q&A portion. So Kat is going to go ahead and ask Dr. Albert several questions first, and then we will turn it over to participants to ask their own questions. So once again, if you do have a question for the presenter about his presentation, please go ahead and put that into the Q&A box if you haven't already, while I go ahead and start with these questions on the screen. So the first question that we have is, you mentioned in your article and this presentation that eye-catching colors and imagery are appealing to youth. How might coalition members be able to utilize this in their own social media posts or campaigns to inform youth? Any suggestions?
Yeah, well, so, a lot of content that I see on social media isn't all that interesting, right? It's hard to create content that really gets people's attention, especially young adults when, as I mentioned, they're just scrolling through all day long. So you need something that really stops them in their tracks. So, thinking about design-wise, visually, something that could be done to really stop them in their tracks and get that attention is important. And the other thing, social media, the really valuable thing about social media is getting people to share content. Well, in other studies that I've done in other topic areas, it makes sense that most people, especially young adults, don't want to share content about healthy behaviors, right? There's just not a lot of, it's not a fun thing to do. It's not that interesting. Passing that along to your fellow followers and friends about things like, eating healthy or maybe not vaping, things like that. That's a hard thing to ask young adults to do, to have them do that sort of behavior. So I think we have to think about how we could create content that maybe is a little bit more subtle in delivering messages like this, how maybe it's cool to not vape, to not use these kind of products, because there's a lot of competition out there. As I mentioned, 10,000 to 1 is pro vaping messages. So sometimes just doing some tests, thinking about what kind of content you want to develop. And the nice thing about social media is that there's a lot of trial and error. Putting something out in social media, there's sometimes not a lot of risk involved. You could see if a message catches hold, and it could just become viral in a way and have a lot of people sharing it.
All right, thank you so much. Next question. Where should coalition members begin to develop their media literacy skills? And what ways can this be applied to educate youth about e-cigarette content on social media?
So there's a really good resource that I know about from the CDC. The CDC has the tobacco education resources for parents and teachers. And they have videos on there, a lot of instructional material just to keep you up to date on the lingo and other terminology and effective ways of creating messages and talking about this topic, whether it's online or whether it is in a different medium like face-to-face. But as I mentioned in the last question, is sometimes it's a little bit of trial and error. It's a little bit of what we call social listening, right? It's just monitoring what's happening on social media. And that's a little bit of what this study is that I talked about today. It's just trying to get a little bit of an understanding of generally what's happening in the environment. So sometimes just being able to look and see and check in, see what's happening in different types of social media platforms, you get a sense of what's being talked about and what the issues are. And it's pretty easy, as I mentioned, to create content, to add to the conversation, to try to change the conversation. So I think just experimentation is a really easy thing to do, and it could be really effective. The more you do it, the more you interact with social media, the more you try it, your literary skills for media and social media will definitely heighten just through that experimentation.
All right, on to question number 3. You mentioned in your article that each social media platform has different use patterns and cultural norms. How might your findings be applied to these other platforms?
Yeah, so this is a good question and something that I'm considering and thinking about for my future research of other things that I want to do. Because as I mentioned, Instagram, there's a certain culture of Instagram. A lot of these individuals that we talked to, they were interested in vaping. They vape socially, but yet they don't consider themselves one of those kind of hardcore vapers, the people who are, blowing smoke and posting all these kind of images. So I think, as I mentioned in the presentation, we have to think about maybe tailoring messages differently to different audiences within different social media platforms. So what we see on Instagram with people maybe posting, images to, that mainly are for a small circle of their family and friends, trying to show, positive aspects of their life, that might be different than on Twitter. That might be different, on social media. So we have to understand the different cultures of all these different social media platforms, and we have to tailor our message differently for each of these groups. And that requires really understanding who these individuals are. The hardcore vapers, they're a different group than your casual vapers. They're a different group than just the social vapers. They're a different group than the people who are kind of curious about vaping and the people who say that they don't want to vape. So I think there's a lot of analysis to be done when it comes to the different audience, the different target audience that we want to consider. And kind of a general rule is you never could get everybody all at once. So it's always good to identify a specific target audience, a specific group of people, and customize your message for those people rather than more of a one-size-fits-all approach.
Thank you for that answer. And so this last one from Katka is, where can interested coalition members find more information about your work? What other resources can you recommend for coalitions interested in content appealing to youth on social media as it relates to substance use?
Well, generally, as I mentioned, there's the CDC website, there's the FDA website. On social media, there's a lot of articles about this topic. Me personally, through Google Scholar, a lot of my work can be found. I have a personal website through my UF website. I don't have the address with me, but it's there. It's easy to find. I'm sure it could be spread. But there's a lot of information about this topic. As I mentioned, young adults, they live online. They're on social media all the time, and there's a lot of vaping content there. And luckily, there are a lot of people doing really good research about this from a policy level, from more of the individual level, from more of a design, branding, advertising level like I'm doing. So luckily, there's a lot out there, a lot of resources for people to learn more about what's happening.
All right. Thank you so much. That concludes the questions from Katka. And so we just have a couple from the Q&A box from the audience. This goes a little bit more specifically into like the study. One question from Matthew: did you end up analyzing the type of devices that were shown in the images that you reviewed?
So we did separate by the type of device, and we found that most were the mods, the tank kind of devices. There was a small portion that were more of a hookah-like device, or kind of a traditional cigarette-like device. But Juul around this time was going through a lot of controversy. So that's the most popular vaping brand. We didn't see any Juul products. So it was really just the mods, that bigger device was really the centerpiece of all the images that we saw.
All right. This next one is from Astrid. She has a couple of them, but they're kind of tied in together. So in the research, she saw that you did cover gender. And were there any perceived racial, ethnic, skin color breakdowns in terms of the imagery and messages? And then also that kind of along the same line of with your interviews with the young adults, if there was any differences there.
Mm-hmm. So looking at the images as part of the original K index, that was one of the categories. It was looking at race, ethnicity. So we actually started to try to code for this, but we found that there were very few people in images. So based on that, and also we found it very difficult to try to determine the race or ethnicity of certain people. So we ended up removing that category from the K index. But overall, I mean, that's an interesting question, right? But overall, we just didn't see a lot of people, in these images. And, as I mentioned, in general advertising practices, promotion practices, it's common to feature people. You show people, interacting with the device, and we did not see that here. It was really just the device. As far as the interviews, our sample, as I mentioned, was mostly female. It was mostly white. So we didn't have a very diverse group that we were interviewing. So that's definitely something to think about in the future about how different groups might interpret these images, especially when they come across them on social media.
All right, thank you. Going to our next question from Evan. He says, my state is about to launch a retail cannabis marketplace in 2022. The Cannabis Control Board will have authority to approve or decline advertising and marketing that targets youth and appears in mediums that have a large projected youth audience. You mentioned the K index. Are there other excellent resources or methodologies you would recommend to help guide states or agencies in how to use those definitions?
And how to use what? I'm sorry?
Use those definitions.
Mm-hmm. Well, yeah, I mean, the K-index is definitely a good tool to use. That's a good one to kind of get more of a landscape of what's going on. In the other study, the interview study, I used a technique called photo elicitation. And that's where I showed people these different types of images just to get their reaction. And as I mentioned, they were drawn to the devices. So I think there's, a lot of different kind of techniques to use to kind of gauge how people are interpreting a lot of these images, a lot of this kind of messaging. Some sort of kind of basic just message testing techniques, I think, could really be utilized. With cannabis, related to e-cigarettes, people using e-cigarettes that way for that function. I think there's a lot of similarities that could be looked at from my study, as well as some other studies that just looked at kind of general perceptions of using these kind of tools to understand how young adults are thinking about these products.
All right, that was a good one. Thank you. Let's see, we have a question from Dana. So if we are planning an anti-vaping campaign, should we even bother with the TV ads based off of some of those charts and advertising that you had mentioned in your presentation?
Right, so I believe print had the most advertising spend. TV, I believe, was pretty close to the bottom. I mean, that's a good question. Once again, I think it depends on your audience, right? So if we're talking about young adults, 18 to 24-year-olds and younger, they really don't watch that much television. They're not, watching cable television shows. If they are watching, it's on Netflix, streaming devices, which there's no advertising, right? So, I mean, my first instinct would be to say, yeah, I don't think that would be necessarily the best way to reach your audience. Looking at social media, look at other types of mediums. YouTube, for instance, is a good one. That's young adults spend a lot of time on YouTube. That's kind of replaced their typical television viewing. It's now replaced with YouTube, just watching different videos all the time. So I'd say I'd probably shy away from television, especially because of the expense. It's not cheap to advertise on television. So the other forms of media are more efficient, they're more inexpensive, and they might be more effective to reach this target audience.
All right, thank you. Looks like we just have one more question. If you do have any more, please go ahead and put them in. But as a health department or organization, what are the legal considerations if we would like to use social media to reach out to youth or young adults? Have you run into that at all?
So there's a lot of, this is really being negotiated a lot in the social media space. So from more of a brand perspective, Instagram, some other social media, they banned influencers from formally, being paid to promote ENDS products. Juul, they took down all of their social media. They knew that was a difficult area for them to be in because it really is, promoting their product to a young audience, which is what they got in trouble for, what they're concerned about. So there's a lot of legal things being negotiated on that side. As far as messaging and interacting maybe with young adults, with consumers, maybe from the other angle, from the the anti-vaping aspect of it. I don't really know of too many kind of legal issues that need to be considered. So kind of broadcasting messages could certainly be done using social media. And the nice thing about social media too is that you get people to follow you, right? You get them to be part of your brand, part of your what your message is, right? So kind of bringing people along, and you multiply that message with all of your followers. So sometimes it could be intimidating to start out with, right? Because you start out with no followers, nobody kind of finding you. But trying to build up a group, trying to build a brand ambassador to carry out that message of, in this case, ENDS, how it, obviously has negative health effects, I think is something that's very viable. And I think as long as you're not personally interacting with certain individuals, maybe directly messaging them or kind of sharing their content necessarily. If they post some sort of image, if you're sharing it outside of the social media platform, I'm not aware of any sort of legal issues in regards to that.
All right. Thank you. And one more question did come in, so maybe we'll make this one the last one for you. This is Jackie. It has to do with the advertising again. So some social media, such as Facebook, disallow ads that include messaging related to alcohol and other drugs, even if it is prevention focused. Do you have any comments or advice on how to address this?
So how to address other types of, you were saying alcohol sort of things?
Yeah, just messaging about alcohol and other drugs and maybe, tobacco and they're just not being allowed, even if it is prevention focused.
Right. Well, I think this is a tricky area because we want to be able to, design a message that resonates with certain individuals, with the target audience we're going after. And I mentioned the boomerang effect before too. So there's a very fine line of, developing a message that resonates with people, where they really see the message as opposed to them kind of churning away from it. So once again, I think really understanding your audience is important. When it comes to social media, social media is all about sharing. It's all about spreading content, kind of liking something and having other people like it. So, you want to think about what the effects are of any content or image that you put out there. What is the best case scenario? What is the worst case scenario as far as, it being spread? So you always want to think about that. If you put something out there, what is going to happen? What are the consequences? Because the last thing you want to happen is that boomerang effect where, your message is being, mocked in a certain way, or it's being used to fuel the behavior that you're trying to prevent.
All right. Yeah, thank you so much. That was our last question for this webinar. And so let me go ahead and go to the next slide and just kind of wrap everything up. So as mentioned earlier, I will distribute the slides to those who participated following this webinar. That email will also contain a short evaluation for this webinar, so please make sure to fill it out. If you would like a letter of participation, you will see a link to view and download it from the thank you page of the evaluation. So really what this means is if you have to fill out the evaluation to get the letter, and you must download it right away after you fill out the evaluation, because you will not be able to get back to that thank you page later. I will also post the recording of the webinar and the resources mentioned in this presentation on the CADCA website in the next week or so. So just keep an eye out for that. And once again, there is limited access to the link to Dr. Alpert's article. So you can just email me at evaluation@cadca.org to request that. And so that's really it. Thank you again, Dr. Alpert, for the wonderful comprehensive presentation on your work and for your commitment to providing relevant and current material. And thank you to the webinar participants for your comments, questions, and insights. We hope you learned a lot, and we'll see you next time.
Thank you.
Thank you so much, everybody.